Larry Elder, is this a win for conservatives? Because you've got the progressive base in some corners at each other's throat over this, saying it doesn't go far enough.
Of course it's not a win for conservatives. It's not a win for people who believe in the Constitution. It's not a win for people who believe that government's job is not to provide health care insurance for those who don't have it. There are lots of ways of providing things for people who don't have it, and it's called competition. In Massachusetts, much of the Romney Care program has many of the elements that apparently this one has, including requiring insurance companies to enroll people with pre-existing illnesses. What happened? The premiums went up. People did not enroll. They paid the fine. When they got sick, they enrolled, got treatment. When they got well, they dropped the coverage.
Why don't they repeal it in Massachusetts?
Through the roof.
Why don't they repeal it in Massachusetts? Why don't they repeal it?
I'll tell you, well, they already are reforming it, kicking off a lot of people.
Why don't they have a
and it wouldn't work. Wait, Ed, it wouldn't work but for a cash infusion from the federal government, which means you and I are paying for health care for people in Massachusetts. Otherwise, it wouldn't work.
No, well, that's a very negative attitude towards it all. The fact is more people in Massachusetts are covered now than before they started the program. That is a fact.
And the premiums have exceeded the national average.
So what? We got to pay for it. You got a healthier society. All right, A.B. Stoddard, how do you view this? There is going to be a public option, but it's not going to be as robust as the base wants.
Well, Ed, I know I've heard your comments all through the program tonight about how frustrated you are, but the facts are you've got the Democratic Party that Americans elected controlling the House and Senate, and these are the votes that you have. You don't have the votes for a public option tied to Medicare rates, and you have serious questions remaining on the table about affordability and other issues that the mandate will bring. So until even this package is not a guarantee.
Well, no, wait a minute. We haven't had the CBO score yet. Now, well, before you get into the finance, now we haven't had the CBO score of the bill in the Senate, and this was coming out right now has not been completely scored either.
I'm just saying this issue of Medicare reimbursement is a huge problem.
Sure it is.
That is not getting solved. It's not in the House bill. We don't have the funding for it. They can't figure this out.
There's rural versus urban. The CBO is saying that the House bill is going to be budget neutral this decade and next. But there's not a whole lot of fudging going on about this. I think the important point here, Ed, is that this isn't over. Still, it is not over. It goes back. There'll be more amendments, and it's a real test for our democracy. Are we going to have health care policy made by we the people or by the people that brought us cancer as a pre-existing condition?
I want to play this piece of tape. This is Harry Reid making a web appeal. He says, I believe in the public option. It creates fairness. That's why what we're trying to do. Do we have that soundbite? Okay, we don't. All right, here it is.
I believe in a public option. It creates a level playing field with the insurance companies and creates fairness. That's what we're trying to do. But we're moving down the road on the process to have health care reform for our country. This is so important. Anyone that cares about it, make sure you contact your representatives back here in Washington and push hard. We want a health care bill that has a public option that keeps the insurance companies honest.
Larry Elder, your response to that? Harry Reid's not throwing in the towel on this.
Well, I wouldn't expect him to. I would ask you to take a look, Ed, at Hawaii, Obama's home state.
No, I'm asking you about Harry Reid. I'm asking you about a guy who is in trouble in Nevada, and he is pushing hard for the public option. Do you have a comment on what Harry Reid is doing? Don't switch the subject and talk about Massachusetts and Hawaii. This is about Harry Reid showing some leadership.
I'm sorry I'm bringing unpleasant facts to the table here, but they had a public option.
Answer the question, Larry.
They had a public
Harry Reid is not giving up on the public option. He is reaching out to the base, saying, "Look, this is not over."
There's one other thing.
You're supposed to be a media commentator. I thought I could get something out of you tonight. Go ahead, Laura.
I said, Ed, I wouldn't expect Harry Reid. May I comment, please?
to
May I
fight
comment,
on this.
Please?
They've been a campaign raising money for a candidate to run against, so they've already raised $15,000 in 24 hours. I mean, Harry Reid knows the statistics out there. He knows how the politics is running, and he knows what people want, and they want a robust public option that will really provide some competition for the private plan.
All right, panel, stay with us. We'll come back. We've got other things, and we'll try to stay on topic. Next up, positive economic development growth numbers are on the table. We'll talk about that when we come back.